Welcome to Podcast UK.
Hi, Sanjay Majumder here, plastic surgery consultant from the UK. Today we have an uber short episode of Podcast UK, an espresso break episode if you will. So for today's episode we're going to discuss the DAIR procedure. Now the DAIR procedure is sometimes used by orthopedic surgeons in the management of infected prostheses such as hip and knee replacements. What is it? Why is it used? When is it used? And why do we plastic surgeons need to know about it? Well, firstly, you may be asked about it in your exam. Now that's a pretty good reason to know what the DAIR procedure is. However, as plastic surgeons are often involved as part of the MDT for the management of patients with infected prostheses, I think it's important for us to know what the orthopedic surgeons mean when they use the term DAIR procedure. And it may possibly inform our decision regarding reconstructive options of the soft tissue of the infected joint and the timing of such procedures. Right, let's start with what is it? DAIR is an acronym which stands for debridement, antibiotics, and implant retention. In the DAIR procedure, the infected joint is thoroughly debrided. Obviously, antibiotics commence, and the metal, often cemented stems, and the base plates of the implants are left in situ, while the polyethylene modular inserts within the infected joint are removed and exchanged for new ones. Now, why is it used? Well, the DAIR procedure has had variable success, and two-stage revision is still the gold standard for an infected prosthesis. But whilst the two-stage revision has a significant advantage of removal of all the potentially infected tissue, there are also significant potential disadvantages. To start with, it's two procedures. So 2 anesthetics, 2 operations. There may be difficulty in removing prosthesis, difficulty in replacing the new prosthesis. There may be fractures associated with both the removal stage and the resiting of the implant. And of course, there's the morbidity associated with the stage in between when the patient has just a spacer in the joint. So when is it considered? Well, the DAIR procedure is used in selective situations instead of a two-stage revision of the prosthesis. It is only a consideration prosthesis in which there's a metal component, which is fixed to the bone, with modular polyethylene inserts for the articulating components. It is also only a consideration patients who have presented early in the course of infection, not one that's exuding pus. And relative contraindications include the presence of a sinus, immunocompromised patients, delay between the onset of infection and debridement procedure, and multiple debridement procedures. So there you go. You now know what the DAIR procedure is, why it's used, and when it's considered. Knowledge is power.
Podcast UK is a collaboration between UK and Irish plastic surgery trainees and consultants. The content reflects individuals' practice and opinions may vary. If you have any feedback, do get in touch. We hope that this has been interesting and useful. If it has, remember to follow us for future sessions.